What's going on, guys? I'm Dr. Khan. These are the angiotensin receptor blockers, and this is namely losartan, valsartan, candesartan, telmisartan, all the sartans. I'm going to have this listed on the screen right now for you to look at. But first, let's talk about how these medications actually work so we have a good idea of what it is actually doing to our body. So what they do is they open up our blood vessels. When they open up our blood vessels, that means that there is less pressure flowing through these vessels. Now there's something called angiotensin 2. When angiotensin 2 attaches onto its receptor, then it leads to contraction of these vessels. Now when these angiotensin 2 receptor blockers, these medication, they actually bind onto the receptor and they prevent angiotensin 2 from attaching onto this receptor. This leads to opening up the blood vessels. Now guys, just to understand this, whenever there's a pipe and the pipe is tight and the water is flowing through that pipe, there is a lot of pressure in the walls. Now if the pipe opens up, then there is reduced amount of pressure on the walls, and this is the same principle by which these angiotensin receptor blockers actually act, how valsartan actually acts, how losartan actually acts. Now let's move forward. Now what are the uses of this medication? Apart from high blood pressure, these medications are used if you have diabetes. Now when people have diabetes, you tend to hurt your kidneys. Now these medications can actually prevent kidneys from going bad, and they slow the worsening of the kidneys. So this could be fairly important in people with diabetes. Now the next benefit you have with this medication is on the heart. Now when you have a heart attack, these medications actually prevent the heart from actually breaking down a little bit. This is called remodeling. It prevents the remodeling. You don't want the heart to remodel. The heart is perfectly as it is. If the heart remodels, that means that the heart is losing its architecture. So these medications are actually good for the heart, especially after heart attacks. Now on to the adverse effects, the side effects of this medication, and there will be 7 most important side effects. Number 1 is going to be hyperkalemia. That means your potassium level is going high. What is potassium? Potassium is an essential electrolyte in the blood. It can be fairly dangerous if its levels go high. Now around 3 to 4% of people actually get their potassium raised through these medications, but your doctor should be watching out for that after they start this medication. Now number 2 is going to be kidney problems. It could actually hamper, it could actually damage your kidneys. Now this actually happens in around 2% of the people, and this could be significant that your doctor may end up stopping these medications. So your doctor is always going to be checking for any kidney damage, any decrease in the kidney function with any of these medications. Now these medications can also cause a cough, a dry hacking cough that can be fairly irritating. Now this could happen in around 2% of the patients, and people may need to stop these medication or change to a different type of the same medication. For example, if you're taking valsartan, your doctor may switch you to losartan and see if you are doing any better. Because these are such good medication, your doctor wants to keep you on these medication, and they may switch you around a little bit, see how you are doing. Now the number 5th side effect is hypotension, meaning low blood pressure. Of course, if you are taking a high blood pressure medication, it may lower your blood pressure. Or of course it could happen if you are lying and then you are sitting up and then standing. If you do this too quickly, you could cause yourself to lower your blood pressure quickly with these medication. Now in a very small group of people, around 1 to 2% of the people, it could be very significant that your blood pressure drops very strongly. That could lead you to actually stopping these medication, and nothing may actually work. So you may have to actually stop these medication. Now number 6 is going to be diarrhea. People can develop chronic, meaning long-lasting diarrhea that could last weeks or even months on these medication. Of course, very few people will actually have this problem, 1 to 2% of the people, but if you have this problem, then you have to keep note of this. And if you are having diarrhea and you don't know, and your doctor does not know where it is coming from, hey, suggest to the doctor, hey, I started this medication. Could this medication be the cause of my problems? Sometimes these things are missed. That is why I'm making these videos, so we are all informed and we know what to do in case some of these things happen. So make sure you keep diarrhea in mind when you're starting any of these medication. Now, number 7 is a side effect that is rare, fairly rare, and I believe it is going to be handled pretty well. It is cancer. Now, this was a recent scare where the FDA, the Food and Drug Administration here in the US, had to recall valsartan because during the process of putting this medication together, there were some impurities there. This impurity can potentially lead to cancer. Now, don't get scared. The government has fixed this problem and a better form of valsartan is now available in the market. And even when it was recalled, it was out of abundance of caution because to get 1 case of cancer, about 8,000 people needed to take this medication continuously, a heavy dose for about 4 years for 1 case of cancer to be produced. In any case, you can see how much research and monitoring goes on with these medications that the government, the FDA, was able to pick up a case of cancer in 8,000 people after they were taking this medication continuously on a heavy dose for 4 years. So you have to be careful with this. So that basically means that these medications are monitored very, very closely. But now this should not be a problem because this has been remedied and fixed. Now some extra side effects. So you could have metallic taste, a sore taste in your mouth. You could have sinusitis, your nose gets tight. You could have flu-like symptoms. Some very rare reactions leading to swelling of the face called angioedema. This could also happen. This could be fairly significant and dangerous. In case this happens, go to the emergency department. Your doctor in the clinic cannot really do anything. So now how to reduce these side effects? Well, these medications, you should start them off at a lower dose. Ask your doctor, hey, is this a low dose that I'm starting off with? The reason is because it takes actually a while, maybe a few weeks even, for actual blood pressure lowering effect of these medications. So don't be put on a high dose of the medication from the get-go because then you run the risk of having these side effects much more pronounced and much more earlier. Okay, now in what situations should you never take these medications? So number 1 is going to be pregnancy. Do not take this medication when you are pregnant, especially in the 2nd or 3rd trimester, because this could lead to a condition called oligohydramnios, basically meaning that the amniotic fluid, the fluid that supports the baby in the womb, is actually fairly low. This could actually have toxic, fatal effects on the fetus, so this is very dangerous. Next, if you are a breastfeeding female, then don't use this medication because it has been shown that this could be transmitted through the breast milk, so just be cautious in that sense as well. Next, if you have a condition called renal artery stenosis, meaning the vessels, the blood vessels that are going to your kidneys on both sides, if they are tight, then do not take this medication. This could cause kidney problems as well as blood pressure problems further. And last, do not take these medications along with ACE inhibitors, meaning lisinopril, enalapril, ramipril. These medications should not be combined because they have a sort of a similar mechanism of action. So don't combine similar mechanisms together. That could lead to more pronounced side effects. We don't want that. Anyways, I wanted to go over this very important medication group, angiotensin receptor blockers. So let me know what you think in the comments below. Have you had any of these side effects, or have you had any other side effects that I may have missed? And of course, always let me know where you're watching this video from, because I do believe I do have a global audience and I love to share this information so that we are all informed. And sometimes we don't want to miss things. Even the doctor can miss things, but it is our health. We need to know for ourselves so we can make better decisions. And if you're looking for a blood pressure machine that is fairly accurate, I'll have an affiliate link in the description below. Do check that out as well. Anyways, let me know what you guys think. Let me know in the comments below. I would love to continue this discussion forward.
And if you really want to work on your blood pressure, I have a detailed course which I call the Blood Pressure Boss course. It will get you the knowledge that you need to correct your blood pressure. It goes over aspects of the physiology of blood pressure as well as natural treatments and supplements and exercises, all of this without medication. And you can start doing this right now and today because it is readily available. And if you are taking medication, it goes over the uses, the most common side effects that you should know about. You have the whole course. So the good thing about this is you have the whole course available to yourselves. You can watch it whenever you want. It is also so economical that everybody can afford it, and it is the same price as a regular dinner outing. Although I feel that the value you will get is truly priceless, it will get you in the mood to fix your blood pressure. That's the real benefit in my opinion, and you will take your health seriously and give yourself the motivation that you need. I also have motivational videos in that course. Thank you so much. Talk to you guys soon.